Hello and welcome all across EH Nation, wherever that may be for you. Welcome to another episode of the Beyond Data Management Podcast, powered and brought to your device of choice every week by HS GovTech. I'm your host, Cameron Garrison, and we're going to, one of the things that a lot of guests and conversations on this show have talked about is the need, a big need for the environmental health profession and discipline more broadly to have who's the next generation of good, young, smart scientists and minds that will come in when those of us, folks that are my age or a little bit older, will be played off the stage. And there's some concern in the community that there's not enough of a pipeline that has been developed, not enough to market environmental health, make it appealing to attract the next generation of talent. But I think today's conversation will give all of you who have had those concerns a ray of sunshine and some hope. We're going to talk to one of the next generation of environmental health professionals here today, and really honored and appreciate she's actually in India visiting family, and so joining us from a long way away from where we are here in North Carolina today, but really excited to welcome Mahek Zaveri into the Beyond Data Management studios with us here virtually. She's a master's graduate, Master's of Public Health, MPH, at the University of Pittsburgh. So we are recording this in mid-August, just past mid-August, the 20th to be exact. And so she will be graduating in December. So a long road for her is about over, and then the next one begins. Mahek, thank you so much for joining us today. You've got a really clear connection. You're joining us from halfway around the globe, literally. Where are you currently?
I am currently in Ahmedabad, Gujarat, which is in India, and that is my home. That is where I grew up for like past 23 years of my life. So I'm here visiting my family currently, and I'm so excited because the last semester of my MPH graduate degree starts next week. So
that's
yay,
exciting.
I'll
Back
be
to
in States
class.
soon.
And somehow probably you're not dreading it at all, right? Because it's the last time you have to start a semester. So that's fun. Do I even want to know what time it is right now where you are? So it's 1:42 p.m. When we're recording this, where we're at. What time is it there?
It's 11:42 p.m. here.
Okay, so it's almost bedtime.
Yes.
I really thank you so much for wow, you look great considering that it's almost midnight. Like if I asked somebody to guess what time it was where you were sitting as our guest, they'd probably say, I don't know, noon. You look very fresh considering that it's almost bedtime. But thank you for taking time out from visiting your family late at night to do this with us. So let's talk about your story and how you got there. Like there has been so many people made comments to me. I'm worried about who's coming next. But then I go to like NEHA. We were there in Phoenix and met you and a couple of others from the intern program at NEHA. And there are some good ones out there. Maybe we need more, but there's some good ones. How did you get here? Because you grew up in India, correct? What put you like on the path? And then as you grew up, were you always drawn to medical or environmental health? Like, tell us a little bit about what you aspired to be as you were growing up in India, and then how that evolved to the path that you're on now, which is fully about to finish your master's and be a public health official.
So I grew up in one of the metro cities of India, which is Ahmedabad, and I since I was a child, I always wanted to help people and to be in the field working for the people, because for me health was something which was of great importance, because there were people in my family who faced a lot of health issues, which has always drawn me to this field of healthcare in general. So I always wanted to be a doctor. I remember myself playing with the little doctor sets that used to come. And from there, I cleared my grade A's entrance exam of all times, which is one of the most competitive ones. And it was the NEET examination. And I scored well on that and I got myself into dentistry. So I was beyond happy at that point of time when I got selected into dentistry. And I started my dental journey from there. It was an extensive 5 year program which molded me to who I am today. And of course, my parents who helped me and who supported me with everything. I did not have to worry about my finances because they were there for me, standing behind my back and telling me to move forward into my life and to pursue my dreams. And when I was doing my dentistry, I remember that when I treated my first patient during my third year of dentistry, I just got to know, I just had a sense that oral health is beyond this dental chair. It is beyond what I treat in patients. So that helped me to dive more deeper into the field which I am today, which is environmental health. And I started reading articles and I connected with my professors in my university back in India, and they taught me. I got to know that it is really beyond that dental chair in which the patient comes and sits in. It literally starts way before they have reached that chair. So I wanted to know all that aspects that brings them to that dental chair, and I want to avoid that beforehand. So this was the field. Environmental health is the field lets which introduces you to all the factors in which a, per- a person can be prevented from a lot of diseases because your environment plays a very, very important role in either make your health or break your health. So
Hmm.
that is why I got into this field,
So,
and
Mahek,
I'm here.
I know that it's not generally considered the thing to do to ask a woman her age ever, but I kind of want to ask you because you're clearly really, really smart. I mean, let's get your master's, but did I hear you say a 5 year dental program?
Yes,
You
you
are in a
did.
rush to get going with life, eh?
So in India, all the extensive programs, even if it is medical or dental, they are all 5 years and it's a make or break kind of thing. And about my age, I'm 24, so I am
Wow,
a little bit in rush to finish everything.
you
And
are.
it started, yeah. And it started when my parents decided to let me go off to school early. I was 2.5 and I have already skipped preschool. I was directly in the nursery grade. So, yeah, they have been in a hurry and I just carried.
Well, they must be really, really proud.
Yeah.
They have to be like 24. I think so. You're making a lot of people feel bad right now because they're thinking back to where was I and what was I doing at 24. Probably very few people will say, "Oh, by 24, I had been treating dental patients and I'm getting ready to graduate from my master's." So it's like respect. That's really amazing on that front. I understand too. It's your first podcast, right?
Yeah.
That you ever done, right? That you've been like the guest on, and it'll be the first of many. The requests will build up over the course of your career. So, can we talk about the dental a little bit? So, it sounds like initially you maybe thought you would be a dentist. You got to the point of seeing patients. What was that? What your plan or thought process was when you were a bit younger, and what all did you do? Were you doing root canals, or like what all were you involved in the treatment that you did while you were doing dental work?
So, when I was back in India and I was practicing dentistry in AMC Dental College and Hospital, I treated over 400 patients, which involved doing extensive root canal treatments, assessing them for their oral cancers, providing them all kinds of endodontic and cosmetic treatments, and even provide people teeth, that is making dentures for people, the complete dentures, which are
Really?
normally known as the
Okay,
full
so
mouth
I
dentures.
I give up. I thought, okay, I'll say root canals. Just say no. I didn't get to that point, but no, you did root canals, dentures. I'm dating myself. There's probably no way you'll get this reference because I'm really old compared to you. But do we have Doogie Howser on today? It was a TV show, 80s, I think, right, David? David's probably too young for this too. Man, I'm really getting too old, Mahek. Tina, everybody in the booth, and you probably don't get the reference. But it was a very popular TV show about basically, I think, an elementary school age kid. His name was Doogie Howser, and the show was Doogie Howser MD because he was a doctor, but he was still just a kid. So you did root canals. Wow. Did you do extractions? Did you ever pull? Okay, yeah.
Yes,
Oh, David, thank you.
yes.
So, yes, sorry, but heck, if you can see it on the screen share. Yeah, that's Doogie Howser. Not much younger than you are. Um, American TV used to be even cheesier than it is now, believe it or not. But they're very impressive. Root canals. Yes, which is
Extractions.
NPH. Neil Patrick Harris. You might have seen him. He's been in much shows much more recently, and is hilarious. Harold and Kumar, I think, are my favorite movies that he's in. But yeah, no, it's very impressive. Did you also do things like extractions or crowns? Like, so you did everything.
Yes. So in India, when you clear your dentistry, it is crazy. Trust me. That 1 year of dental internship, we are trained and tested beyond our limits. I remember during my final year university examination, there were 8 extensive days of extensive examinations, and where you have to just cram onto books. There was no option, and you just cram onto books. And those 8 days were, I don't remember sleeping more than 5 hours. I don't had any idea that it was humanly possible before that you can just stay up and study, because I did that. Because when you it's like a situation where you are going to make or break your career. Everyone ends up with such a situation in their life once. And yeah, those 8 days were the best and the worst of my life, because I studied hard, like real hard. And when I got that first class on my mark sheet, I was so relieved that, yay, the transcript was worth anything I would give right now. Yeah, so those 8 days were extensive.
Yeah,
And
and
then
you
I
and,
started.
and then they give you a drill, and you start to get to drill people's teeth.
Yeah. And then they trust us with people's teeth and their smiles, which were very important to us. So that gave me a real boost. And that 1 year of internship, I did everything from extractions to endodontic treatments, every dental thing you can possibly imagine. We
Wow.
were also allowed to do disimpactions, which was removing your third molar. Uh, I
Oh yeah.
also did that. Yeah.
Well, that is just crazy. And I mean, it's a very like it's a billion people that need dentist work, right? I mean, for I think most people are aware, but huge dynamic country. And is there a shortage of dentists, or it's like this is just how it's normally done?
There is not shortage of dentists, but there is real shortage of good dentists, I would say, because a lot of people here believe in malpractices, and they they don't do right to people.
Hmm.
That is what I feel. So there is a real need of good dentists, I would say, and if you are true to your patients, that is the best thing you could do. I would just want to everyone to have that faith that when you are having another person's life in your hand or another person's smile in your hand, don't cheat with that. So that is what
Oh,
I would say. It happens a
yeah.
lot in India.
That's that's actually really awesome. Like you've got someone's smile in your hand. Don't screw with that. So you literally, it's a 5-year program. You're 24 now, so you're a teenage dentist. And I
Yes.
mean that in America, that's a big, that'd be a huge deal. What made you think about, because it's a huge, we have several people at HS GovTech that I've had the honor of working with here through the years that also came over from India and started their life. They uprooted their life. They'd grown up there, all their families there. I've always just had the most respect. They work so hard. And I'm not sure, I'll be honest with you, I'm not sure that even at your age, I would have been too good with literally uprooting my life, moving to a completely different place halfway around the world. What got you thinking about that? And then more specifically, what had you starting to hone in on, you know what, I think I want to get involved in environmental health? And what did you do to initially get yourself on that path? And when did you come over to the States?
So I came to States in 2023 December. My program started in 24 January. So that was the till the moment I stepped into New York. It was a beautiful journey itself, and I have a distinguished respect for each and every person from India who leaves home, not only from India, from all over the world, who leaves home, who leaves their family to pursue the career of their dreams, because you are going to miss a lot of birthdays, you are going to miss a lot of important moments in your life, but you do it all just because you want to do something great for people. You want to do something great for your dreams. And that is the thing which I respect the most. So, if I talk about my journey, while I was doing dentistry, as I said, when I treated my first patient when I was in third year of my dentistry, I wanted to do something which was unique, which was more into prevention rather than cure. So, and I started researching, I started talking to people that what is the field that is most emerging right now in base of preventative measures, and it led me to environmental health. So, environmental health is the field that if you are really into that field, you can know a lot of things beforehand. You can prevent a lot of diseases, you can prevent a lot of emergencies. Emergencies can happen anytime, but if you are into environmental health, you would have a way in which you can, if not prevent them, just act quickly to them. And that is what I think today's world is in need of. So that is my whole journey. I applied when I was in my internship year, which was in July. I applied to two universities. One was University of Pittsburgh, other was NYU. Uh, I got accepted to both, and I chose Pitt because it just I I I still don't know that why I chose Pitt, but Pitt and NYU both had really great programs. So it was just my heart which led me to Pitt, I would say. And I am when I stepped into New York, there was a 3 hour halt, I remember, and it was the most weirdest feeling in the world. I was happy, I was excited, and I have cried my whole flight because I left my family behind. But today, when I see them proud of me, today, when I see my father's eyes, and they say that every single penny that he spent it on me, every single dream that he had and he didn't get to fulfill, when he sees me today, I know that I am halfway through it to at least give him that peace of mind that his children has done something in this life. And healthcare is so dear to me because it was my mother's dream to become a doctor, and she never get to pursue that dream due to many financial hardships and a lot of situations at that time. But when she sees me today, working in healthcare, working in environmental health, she seems proud, and that is the biggest win. That is bigger than any of the degree you could achieve in life. So that is my
Yeah.
story.
It's more, yeah, and I know they must be so proud if they're watching this. Well done, you all. Yeah, a lot of reasons to be proud. Um, So you did an internship recently. You have now experienced being in an environmental health department. In fact, I don't know, David and Tina in the control room, do we have a the image of that you had posted on LinkedIn, kind of a summary of your? I don't know if they can hear me in there, but we might have that. They'll throw it up if we do. You did an internship at Pima County, and you did summarize it on LinkedIn, which is all we were going to throw up there. But maybe tell us a little bit about what you've done the last few months with the fine folks out in Arizona. And boy, you have gotten around, haven't you? You came to New York, you're going to school in Pennsylvania, and you just did your internship in Arizona. But tell us a little bit about what you've just finished doing and how that makes you feel about your career choice in the future.
So the time at Pima County, which I had, which it was the best experience anyone could have working for the first time in United States, and especially working with the government of United States, which I am truly honored to be a part of. So I applied to the NEHA internship program uh, during my second semester. I would no, my third semester, I would say, and I was tracking every Neha move up till then, because when I look when you're going into a field and you look up that what is the best organization you get into when you are in that field specifically, the first name that comes up is the National Environmental Health Association of United States. It is the most prestigious thing for any environmental health professional, and I had an honor working for NEPHIP. I was placed at Pima County Health Department in Tucson, Arizona. There, my chief task was to revise the environmental health preparedness plan of Pima County, which I did by doing extensive literature reviews, uh, going through all the CDC toolkits possible, coordinating with the Departments of Consumer Protection and Food Safety and Epidemiology, and the final product that I delivered was a fully revised, FEMA aligned, the Environmental Health Operations Plan for Pima County. And I would say that I'm proud of it because my mentor was really happy when I delivered my work. My peers at NEPHIP were really happy by my the final project which I delivered, and my advisor and my academic legion at university were happy. So that gave me the confidence that my job was well done. And this was what I did the whole summer.
That
Uh,
that's big
during
stuff.
yeah,
I'm sorry. During what? You'll continue. I didn't mean to step on your sentence.
no, it's all right. During my internship, I also get to visit the NEHA AEC annual conference in Phoenix,
Where I
where I
met
met
you.
you guys.
Yeah.
Yeah. So that was the most amazing experience. It was my first conference attending in United States. It was the first biggest conference I ever attended. So it was an amazing experience. I met people like you there, and I was truly honored. I got to know that how environmental health looked like, and that also deepened my interest in the field of environmental health. Looking at so many professionals gathered in one single place makes you feel that you are doing something right in your life and you should go on forward with it. So all
Yeah.
this deepened my interest in environmental health.
It was a good conference this year, good energy, and it is a great chance to meet people doing all sorts of things across the country. So, emergency preparedness that gets into some pretty heavy stuff. I'm sure as you were there any things as you were going through and doing all of that work where it's like, whoa, that's kind of scary, or did you find yourself saying sometimes, I really hope that we don't live to see the day where we're actually having to put this into effect? Were there some of those moments for you when you were doing that work?
Yeah, so currently the main threat that the whole public health is facing is vector-borne diseases. So it is a real threat because the cases of dengue, Zika, and everything is rising on an alarming rate. And I revised an annex on vector-borne diseases, and I just wish and I hope that we don't have to ever put it in action. That I never hear from United States that there has been a dengue outbreak, which is bad because I myself had dengue. So
You
I
did?
suffered from it.
Oh,
Yes.
wow. What was that
I
like?
suffered from uh it is it makes you weak. So your whole body feels like you feel weak all over, you have no strength left, and it is real dangerous because it directly affects your platelet counts, and your platelet counts lower significantly, and if you don't pay attention and you don't get it checked regularly, there may be a chance of internal bleeding. So it was a real scary time when I faced that, because it is common in India and we have dengue outbreaks here, and it is bad. So I never wanted to happen in United States, because United States and developed countries like United States are lucky that they don't have this kinds of diseases going
Y-
on there right now, and it is best if we prevent that. So I never want to
It
put that
definitely
specifically on
is.
it.
Yeah, Dr. Dijak, you probably got to meet him, right? And got to know him a
Yeah.
little bit at NEHA. He was on a couple of months ago, and actually, dengue was exactly what he mentioned too, because he said there's actually quite a few cases that like have popped up in Florida, and he feels like that we need to really see to it that, to your point, we prevent it, because he feels like we might be
Yes.
closer to it breaking out than maybe we have been in the United States in quite some time.
Yes. So the areas like Texas and Florida, as you mentioned, are more affected by it. And we should try our best to prevent that. All the epidemiology teams and vector-borne teams are working their level best so they can prevent this deadly outbreaks of vector-borne diseases, because it's not just only till dengue. The viruses like Zika are even also very prevalent. Zika, chikungunya, these are all very prevalent in other countries, but those are not in United States, and we want to keep it that way. We want to keep the country safe from specifically the diseases which are spreading these days, I would say.
Yeah. And yeah, vector too, I think screwworm technically falls under vector, right? Which is, the vector, they don't live on the front of the mind for most people day to day, but they're there and under the surface. And, there's a lot in the news right now about the screwworm and a fear that that's going to start causing a problem for cattle in Texas. Like there's a lot under the category of vector, a lot of threats, aren't there?
Yeah. So, as you mentioned, screwworm, and even when a mosquito bites you, you are just like, it's just a mosquito and it'll go away. You just scratch it a little bit and it's gone. But sometimes it can lead you to very dangerous diseases. So, that is the practice that we all have, that it's just a mosquito bite. It's not going to hurt that much. And it does not. But what if it's carrying a virus? So, you can
Yeah.
never know.
You
So,
never know.
it's better to prevent that.
So after spending the time at Pima County, you're more sure than ever that this is what you want your career to be?
Yes.
And is there
Yes.
any particular aspect of it that you observed or so I actually back up. Sorry. How much across the board did they show you at the emergency preparedness plan? That's a lot of work. So it sounds like that was a big enough project. Did you get to go on an inspection? Did they expose you to any of the other things that they're responsible for while you were there with them?
So while I was not directly involved in inspections, because there was a plan already in place, and I was just in charge of revising it because it was outdated, and my job was to revise it till today, including the recent issues. So it was more theoretical based work rather than field work, I would say. But yeah, I did get to visit their Office of Emergency Management, and I also get to visit their EOC. which is one of the best in the countries, I would
It is.
say.
I've been in that one.
Um,
It's
yeah.
pretty cool, isn't it? Like, it's a really
Yeah.
impressive place.
It's like the one you have seen in the movies.
Yes,
Like all the
yes.
screens light up at once, and
Yeah,
it's
like,
real good.
yeah, it looks like they could probably launch missiles from in there if they wanted to.
Yeah. So
And
I,
there it is. So
yeah.
that's your summary that you put on LinkedIn of
Yes.
what you did there, and got it homogenized with FEMA. That's really awesome. And take a note at her profile, her name there, and her picture, and maybe connect with her if you're out there in the community. Um, was there any part of it, do you think you have a desire to lean in more to the emergency management, the epi side? Did you make any decisions on any element within the department that you liked more than others coming out of that first experience?
So it is not from this only experience, but any experience I have ever had in public health or healthcare in general. My dream is to get into public health communication. It is it is a desire that which I want to fulfill, and like I want to see myself as a communication leader in next 5 years. So public health communication is the topic which interests me the most because that bridges the gap between each and every aspect of public health. So if it's environmental health, public health communication is the key because you want to deliver what you discover to your community. It is so important because sometimes you discover things, and if you don't communicate it properly to your community, it could really cause a panic in the community, I feel, and we want to avoid that at all costs. So public health communication is the field which I want to be in, and I see myself in it in next 5 years.
That is awesome, and you're right. There's not enough communication that goes on, so it's. And also, if you're not communicating, you're not really leading anybody to prevent anything because they don't even know what you're doing. It's a good point. So you're getting ready to graduate with your master's, and Pittsburgh is a great program. So this is not like a critique of any program, but you've been in a department. You did that internship. You've been almost all the way through your grad studies. What's one thing you wish that maybe in hindsight you had more of, or that they focused a little bit more on in the master's programs that you're like, wow, that I wish I'd have gotten a little bit more on that? And was there anything when you actually got into the department, you're like, oh, wow, they didn't tell me about this in grad school?
Yeah, it's basically how you talk to people. So curriculum can give you all the insights on what you need to know, why you need to know about the field, but no one teaches you how to interact with people. That is the skill which should be taught in all the universities, I feel. But that is the thing which I learned when I was in Pima County, when I conversed with people, even if it was with my peers or my supervisors, but I talked to people. I talked to people in various fields. I talked to the director of consumer protection and food safety, and that is there is a professional way to talk to any of the senior professionals you are talking to. While that should be something which should be taught more, like professionalism is the thing which should be taught more, I feel. I'm not criticizing any program, or I would not say that it does not teaches you, but that is the skill which any public health professional or any professional in general should develop. That is what I feel.
You are in very good company with that answer because Dr. Dijak, when we talked to him a couple of months ago, he literally said the same thing. And he said that he goes, in all of the education I've gotten, and he's had a lot, he goes, I didn't have one class on how to talk to people. And he said he had no class on how to communicate with the public. So like you're thinking along the lines of people who have got a very distinguished career in the field. That's the same thing they're saying that you're observing. So leads me to believe that you're right on, that it's a problem, but also good for you. You're paying attention. You're picking up on things that I think some people go through half their career and maybe don't notice or it doesn't dawn on them. So again, impressive. I think you are looking for a job right now. Have you, if I'm wrong about that, have you secured the job that you're going to have after you graduate, or you're looking now? In fact, I think you had put it on LinkedIn. Let's throw that up if we have that post from you as well. So you are about to be, as of the end of this year, available, right? So we have a lot of agencies that watch out there. And if you've just been listening to this for the last 30, 40 minutes, now's your chance. Get your bids in early. She's on the market here soon. You're willing to go pretty much to any of the 50 states, right? Yes. Do you have no preferences, no kind of conditions from talking to you?
No, I am open to work for people anywhere in the United States.
Have you started applying anywhere yet, or probably a little early for that, right?
No, I have started applying because,
Awesome.
as my peers said, it is no early time to apply for jobs. So you want to get your foot into the field as soon as you can. And I have learned it and I am doing it. And I'm so thankful to my family and my friends to tell me that thing, that keep your foot in early, even if it is for less money, but you will gain important knowledge. So I am here, I am willing to work, and I am willing to put my foot forward for the community of United States.
Mahek, you must have amazing parents. That's really good advice that they gave you, and I know that they must be so proud if they watch this. I hopefully they'll get a chance to. That is, of course you're already applying because you were doing root canals at 15, right? So of course you are. You're on a schedule. There's one thing that I can say. Regardless of where you land, whether it's in Alaska, Florida, or anywhere in between, you're going to be successful. You're going to land somewhere. You're going to make a difference. And in any department that you end up with, it's going to be a real benefit to them, because you are aggressive, smart, and a hard worker. So best of luck with your last semester. And we'll check in with you maybe towards the end of the year and see how you're wrapping up. And also keep us posted on your job hunt and where you end up landing. And we'll follow you as you begin this exciting journey. I was going to say begin your professional life, but by my standards, anyone who's done a root canal or pulled a tooth at the ages you did that, not to keep harping on it, but it's just amazing. You've had a professional side to you for a very, very long time, but congrats on everything you've accomplished to date. Thank you so much for joining us at the midnight hour on your time back with your family in India. And I hope you enjoy the last few days before you come back for the final semester of Masters.
Thank you so much. Thank you so much for having me. I'm really, truly honored to be able to speak, and thank you for letting me talk to you. I'm really grateful for this whole initiative that HS GovTech is doing, and I recommend every environmental health professional to watch it once. And there is some amazing, pretty stuff out there, and I wish you all the best as well. And thank you so much for having me over.
Thank you so much. That means a lot. And I have a feeling we're going to be talking to you again, and enjoy the rest of your time in India and safe travels back to the States.
Thank you so much. Thank you so much. Have a good rest of your day.
You too. Well, I told you, for those of you that were worried, there's nobody in the pipeline. I think that's something you can totally say with a straight face again. It's very, very impressive, and also shows you the importance of NEHA's internship program. There's multiple interns in that class, and they've done a great job of getting some great talent and getting them exposed to the field. And so I think we also saw a bit of display of the importance of that as well. So enjoyed the conversation. Hope you all did too. For all of us here at the Beyond Data Management podcast, brought to you by HS GovTech, I'm Cameron Garrison. Thanks for spending the last hour or so with us, and look forward to seeing you again, same place next week. Thanks. Have a good one.